When it comes to patients feeling hesitant to address anything within the realm of mental health, like stress or sleep disturbances or worry, often they do come to a medical visit putting it in terms of their physical symptoms, or really just kind of open-ended, I'm here, and then it's kind of up to us to kind of have a discovery process of like, well, what could be challenging them enough to inspire this visit? There's so many patients who are not ready or are opposed to talking about their feelings or had a negative experience of exposing their feelings in the past. And for those patients, we can get both creative and realistic. Let's get you into an environment where you challenge your body and you get into a flow state. Maybe it's something as simple as trail walking. If you feel socially isolated, how about we get you to a gym that you don't necessarily have to interact with a group of people, but you're familiar with who's there and you recognize them, and you have that continuity of indirect community so that you maybe can sleep better and interact more confidently and get out of your home more easily. Typically, it would be very difficult for someone like me, a physician in the room with a patient, to be sure that a patient actually gets therapy. Counseling therapy, talk therapy, these are all words for a trained provider who we can trust to provide evidence-based services that we know have proof that they will improve the outcome that we hope for a patient. True relief from their mental health burdens, true improvement to their chronic conditions. What used to be common is we say, okay, well, maybe if you already know the therapist, maybe if there's someone locally who accepts your insurance, okay, let's plug you in. But if we think of it in our heads in that moment, like, I don't know how I'm going to get this paid for, I don't know how I'm going to get you scheduled, I don't know how I'm going to convince you to look at their website after this visit. MindHealthy is kind of our answer to this long-standing problem. Because trust is built on relationships, we have a relationship with us, and the counseling then becomes an extension of that trust and relationship. And so it's so much easier for both me, the clinician, my colleagues, and also the patient to trust the process and say, you know what, I like what I'm experiencing here, I like this whole team, I like this clinician, and I'm willing to take it to the next step. I'm going to show up at this next appointment and take it one step at a time. With MindHealthy, we've been implementing this for over a year now, and it just keeps getting better. So more patients are happy with their experience. More patients are coming back to me after a referral and saying, I had a really great experience. I didn't realize how much I needed that. Feedback like that is really heartwarming. It not only lets me know that my approach is working as a clinician, it also helps me feel the purpose of my career.